So a lot of medical doctors ask me around the topic of uncertainty. For them, if you are on a medical career path, a traditional one on the bedside, like a clinical career, you very often have it all lined up for you. You know what you have to invest in terms of time, in terms of trainings you have to do, and you kind of know more or less what you can expect in return. So it's a well-treaded path for you. And that can be nice, but it turns out to be a problem for a lot of doctors who then think about doing something else, because that emotional barrier to handle this, what is perceived as uncertainty, becomes a major obstacle for many. And so I just wanted to share the key thoughts that I have, or also the co-authors of our book, Beyond the Bedside, and I have, is that there are a couple of things that we would like you to reflect on. And first of all, just be aware that this is a very, very common question for many doctors. And I think there's some truth to that, to the fact that doctors often like to have that security, that certainty. It's a profession where you can have a lot of excitement because you see interesting parts of society. You get to talk to a lot of different people from different walks of life. You have stimulating riddles to solve. And frankly, also you see parts of life that most of us, also fortunately, don't get exposed to. But at the same time, you have a lot of safety, right? You typically can expect that there is job safety throughout your career. You have a very clear idea of more or less where your salary will be going throughout your journey. And your day-to-day becomes increasingly predictable. Of course, there's a very steep learning curve in the beginning of your medical career, but then you kind of hit a plateau, and then you can still grow and learn. Yes. But you will have a lot of things that you really feel comfortable dealing with. A lot of diseases, a lot of procedures, and so on. Simply because you have routine, right? So that's something that certainly attracts a certain type of personality, and then it's always nature and nurture. So then you're surrounded with other people who are drawn to that kind of safety in an otherwise fairly exciting, stimulating field, and so you all reinforce your predispositions, and you end up being surrounded by people that don't like uncertainty so much. So let's talk about that, because I think it's an important thing to think about. The first thing that I would like you to reflect on is a saying that I'm sure you have all heard, and that is that typically when people are on their deathbed, they far more regret the things that they did not do than the things that they did. And certainly a life lived in safety can be gratifying. You can add value to other people too. But you might ask yourself a lot of what ifs. And I know a lot of these doctors. I know people that say, well, actually, I always wanted to be an archaeologist. Now it's kind of too late. Maybe it's not, right? Or people who are on the brink of a burnout in their clinic and end up not really knowing what else they could be doing because they've been in the profession for too long and they lack the energy to get out, right? And so they get frustrated on the back of that, right? The other thing is it really uncertainty that you're afraid of? Or is it a sense of insecurity? Is it that you are afraid of not having an income, or having too low of an income, or of being rejected because people don't appreciate the skills that you have acquired and that are precious in your current profession as a doctor but might not be so good somewhere else? Are you afraid of being a beginner again, of feeling like in the first years of medical school or the first years of working as a doctor, that sense of not being good enough, of making mistakes and all of this? Is that what scares you? Well, in that case, what I can say is you are actually fairly safe, because you have already shown that you're able to learn something that's really hard and to go through a journey of growth. Why would you think that you would not be able to muster that energy, that willingness to learn and the willingness to unlearn again? Secondly, you have to question also, how safe are you really in your current job, right? I mean, I don't want to scare people, but we are going through a heavy transformation driven by AI, by large language models, by so many other things. And who knows if you will still have the same job, if you will have a job in the things that you're doing right now. That kind of depends on the profession within medicine that you chose. But also the question is, like, how much will your day-to-day change? And is that something that you will still like? Is it something where people will still pay you the same amount of money? Will you be required to relocate to somewhere else in order to pursue that, right? So there are uncertainties and also some insecurities that anyway expect you, even if you decide to change nothing for yourself, because your environment is changing, and that at a, I think it's fair to say, unprecedented speed in human history, right? So don't establish a false sense of security on which you base your career decisions. And the other thing is, you can always go back, right? You're not, maybe not always, but in many situations and for a fairly long amount of time, it's not like you're burning any bridges or boats or whatever. And it's also not like you have to make a leap of faith and just jump into the dark and see what happens. But frankly, you can do something part-time. You can try things out, right? You don't have to do the most scary thing that is on your mind. You don't have to become an entrepreneur right away. You could join the advisory board of a startup and help them with your medical knowledge. You could become a part-time writer, content producer. You could join politics. But I don't know, whatever it is that gets you excited. In many cases, it is possible to do something part-time, freelance, on the weekend, or as a hobby, and so on first, to just test the waters. And testing the waters in the sense that you can find out, is this something that truly gets you excited? Is it something that allows you to grow? Or is it also something where you believe that your talents will be put to a good use? Something on a more personal note is, when are the moments that you really grew? And growing has several dimensions, right? There's the dimension of growing professionally, of learning new skills. There's the saying that you don't learn to drive in the parked car, right? So you kind of have to get out there. You have to make mistakes. You have to bear the pain of uncertainty, of insecurity, in order to get to something where you can learn new skills that you can be proud of, that can be useful to you, that can help you shape a future that is relevant to you. But then there's also the personal component. It shapes your character. If you keep being in your comfort zone, starting from your late 20s, because you've learned fast, you've studied hard, you have your position in a hospital, and you're not going to move from there, then you're really going to hit a plateau, and your opportunities for personal growth are stunted compared to what you could have if you would be going somewhere else. And there's also another aspect. I had a situation, frankly, where I got in a big fight with one of my senior doctors in another department, and I felt treated very unfairly. And fortunately, other superiors of mine felt the same and ended up protecting me. But until this whole thing completely unfolded and came to a peaceful end, I was heavily attacked by this man who, was ahead of me in so many different ways. And I was in this hospital, and I was frustrated. And not only because I felt unfairly treated, and not only because I was in a completely unbearable situation, but I was also really mad at me because I realized I did not build up any options for myself. Right? I knew that the next day I would have to come back to that hospital. I would have to treat my patients just like before, and I would probably have to make 1 or 2 phone calls with that person that was just busy bullying me very systematically. And there's nothing I could do. I would have to come back. There was no job opening in another hospital nearby that I could easily get. I would have to move much, much further, which had a lot of other consequences. And at that time, I did not have the financial buffer, frankly, to afford a break, right? So that didn't feel good. And if you venture out into uncertainty, you will end up creating options for yourself, because who knows? Maybe there is another company that really, really enjoys the input that you bring. And maybe if you have an impossible situation that you cannot resolve and you need to find an alternative, maybe you already have something lined up for you, right? And you don't have to look with him in a very limited range of options. The other aspect is, if you're watching this video, there are good chances that you're watching it because you are already looking into leaving clinical medicine. And that might be because something feels wrong about that career choice. Now, what's wrong, I think that's worth a separate video. But maybe you feel like you can't use all your talents, or maybe you feel like you're in a toxic environment, or you just don't enjoy it as much as you had hoped, etc. Whatever that might be. But if you don't take a decision to look into something else simply because you are afraid of uncertainty, then the price that you are paying for this uncertainty, for avoiding the uncertainty, is huge, right? Because effectively what it means is that you rather come to work feeling miserable for weeks, months, years, without any perspective that makes you feel like, okay, it's worth that journey, simply because you're afraid of uncertainty. I think that's way too much of a price to pay to avoid the pain and the fears associated with uncertainty. Which, by the way, once you make that leap out, you will realize really isn't that much of a problem, right? There's not so much uncertainty. I don't want to underplay it. There's a lot to do. You will have to unlearn and learn again. You will feel uncomfortable and so on. But trust me that if you've made it this far in your medical career, you have, in all likelihood, everything you need, all the facilities, all the talent, and the energy to reinvent yourself and to find your place somewhere else fairly, fairly fast. And that's really important to know and to be sure of. So with all of this, just give it a try and try to overcome your fears, right? Try to find a way that you can slowly test it. Do systematic destabilization, right? You don't have to do shock therapy. And you will certainly find that it's worth it.